Why do some older women smell like urine even when they're perfectly clean? It's an uncomfortable question, but one that many seniors wonder about in silence. If you've noticed this in yourself or someone you love, you are not alone. And the truth is, this odor isn't always about poor hygiene. In many cases, it comes down to a few common mistakes that are easy to miss, but thankfully, just as easy to fix once you know what to look for. Today, we're going to talk about these hidden causes, gently and without judgment, so you can finally feel fresh and confident again. This video is for you if you've ever felt embarrassed by your scent or worried others might notice something you didn't intend to share. Maybe you've done everything right, you shower, you change clothes, you keep yourself clean, but something still feels off. That lingering smell is not just part of getting older. In fact, it often comes from habits that quietly work against your body's natural balance. And today, we'll uncover 6 key mistakes that cause this issue. These are not personal failures. They're small, everyday choices related to clothing, hydration, hygiene, and even overlooked health concerns. And the final mistake on this list? Almost no one talks about it, but it can affect even the cleanest person. Stay with me until the end, because that last one will surprise you. Now, let's begin. Mistake number 1, wearing incontinence pads for too long. One of the biggest hidden causes of urine odor is wearing incontinence pads or liners for longer than recommended. These products are a lifeline for many older women. They provide protection, freedom, and peace of mind. But here's the catch: if they aren't changed frequently enough, they can become the very thing that creates odor. Here's why: when even a small amount of urine sits in a warm, closed space, bacteria start breaking it down almost immediately. That process releases ammonia-like compounds, the sharp, sour scent most people recognize. Even though pads absorb moisture, they don't eliminate odor. In fact, once a pad is saturated, it can actually trap the smell against your skin and clothing, making it noticeable to others, even if you can't smell it yourself. And many women unknowingly keep pads on too long, either to save money, avoid waste, or simply because they forget. But even a tiny leak is enough to leave behind residue that builds up over time. The longer it stays, the more the odor settles into clothing, skin folds, and even furniture. There's also a health factor. Wearing pads for too long can cause skin irritation, redness, rashes, or even sores. And irritated skin is the perfect environment for bacteria, which only makes the smell worse. I once met a 72-year-old woman named Linda. She was spotless, elegant, and well-groomed, but she always worried about smelling off. One day, her daughter gently mentioned it, and together they discovered she was wearing the same pad from breakfast until evening. Once Linda began changing it every 3 to 4 hours, or immediately after any leak, the odor vanished. She told me, "It was like getting my life back. I had no idea such a small change could make me feel normal again." If you rely on liners or pads, don't stop using them. Just treat them like you would wet clothing. The fresher they are, the fresher you will feel. Your comfort, dignity, and confidence are worth it. And believe me, your loved ones will notice the difference, not just in scent, but in how freely and happily you move through the world. Now, let's move on to mistake number 2. Sometimes, no matter how clean you are, how carefully you dress, or how well you stay hydrated, that stubborn urine odor just won't go away. And when that happens, the cause might not be on the outside, it could be something happening inside your body. One of the most overlooked reasons older women develop a strong urine smell is an undiagnosed bladder or urinary tract infection, UTI. These infections are far more common than most people realize, especially for women over 60. As we age, the urinary tract becomes more sensitive, and the immune system doesn't always respond as strongly as it once did. That means the usual warning signs, like burning during urination, constant urgency, or abdominal pain, might never appear. Instead, you're left with one of the only noticeable symptoms, a persistent, sour, or ammonia-like smell that just doesn't go away. This odor can linger even after showering or changing clothes. It can cling to underwear, bedding, or even the air around you. And because it develops slowly, many women assume it's simply part of aging or something they're doing wrong. But in reality, it's your body's way of signaling that something is off. Take Marlene, for example. She's 76 and told me she had tried everything, changing her pads often, drinking more water, cleaning carefully, but nothing helped. During a routine checkup, her doctor ran a simple urine test and discovered a low-level UTI. Marlene had no pain, no discomfort, nothing but the smell. After just a short course of antibiotics, the odor completely disappeared. She told me, "I didn't even know I had an infection. I thought it was just me." Bladder infections can be more common if you have diabetes, take certain medications, or if mobility issues make it harder to fully empty your bladder. All of these factors allow bacteria to grow more easily, leading to strong odors that no amount of surface cleaning can fix. That's why, if you've tried everything, better hygiene, breathable clothing, hydration, fresh underwear, and the smell still won't go away, it's time to talk to your doctor. A simple test could give you an answer you never expected. Getting treatment doesn't just clear up the smell. It restores comfort, confidence, and that wonderful feeling of being in control of your own body again. If you're still watching and finding these tips helpful, comment #2 below to let me know you're here. And if you haven't already, don't forget to subscribe and turn on the notification bell so you don't miss any future videos that could help you. Now, let's move on. Mistake number 3, skipping hydration to avoid accidents. One of the most common but harmful habits many older women develop is deliberately drinking less water to reduce bathroom trips or prevent accidents. On the surface, it seems logical, less water means less urine and fewer accidents. But here's the problem, when you hold back on hydration, you don't stop producing urine, you just make it more concentrated. Concentrated urine contains less water to dilute waste, which makes it darker, thicker, and far stronger smelling. Even the tiniest leak from this type of urine can leave a sharp, sour odor that clings to clothing, furniture, and skin. And it doesn't stop there. Strong, concentrated urine is also harsher on your skin. It can cause redness, dryness, or even tiny cracks around the pelvic area. This irritation makes it harder to stay clean and creates a vicious cycle. Odor and discomfort keep getting worse, no matter how much you wash. The truth is, staying hydrated actually makes urine less smelly and much easier on your skin. So, instead of cutting back on fluids, the real solution is smarter hydration, drinking enough water consistently throughout the day, but not so much all at once that it overwhelms your bladder. No matter how much you wash, if you're not drinking enough water, the odor problem can persist. Another common issue is that many older women drink just enough to not feel thirsty, without realizing their body actually needs more. As we age, our sense of thirst becomes less reliable. You might not feel thirsty at all, but your body could already be dehydrated. And this lack of moisture doesn't just affect urine, it impacts your skin, your digestion, your energy, and even how well your body flushes out toxins. I once met a woman named Betty, 78, who used to avoid drinking water on purpose because she was terrified she wouldn't make it to the bathroom in time. She thought she was being cautious. But when her nurse encouraged her to start sipping small amounts of water throughout the day, especially a glass first thing in the morning, everything changed. Her urine became lighter, the odor faded, and even her skin looked healthier. Betty told me, "I was scared of water for so long, but I didn't realize avoiding it was making everything worse." You don't need to drink gallons. Just start with small, steady sips. Keep a glass or bottle nearby and make it a habit. Remember, your body works best when it's properly hydrated, including its ability to keep you feeling fresh and confident. More water doesn't mean more accidents. It means better health and less odor, from the inside out. Mistake number 4, poor ventilation in clothing choices. What you wear each day isn't just about style, it also affects how your body breathes, and ultimately, how you smell. For many older women, one of the biggest mistakes that makes urine odor linger longer than it should is wearing clothes that trap heat and moisture. Tight, non-breathable fabrics around the pelvic area create the perfect environment for bacteria to grow, and for odor to stick. Many women choose snug underwear, pants, or shapewear for appearance or support. But these garments are often made of synthetic materials like nylon, polyester, or spandex. Unlike cotton or bamboo, these fabrics don't allow moisture to escape. So, if you experience even a small leak, or if your skin simply stays warm throughout the day, that trapped humidity has nowhere to go. Over time, it creates a breeding ground for odor-causing bacteria. And it's not just underwear. Tight leggings or pants made from synthetic fabrics can hold odor close to your body, even if you shower regularly. By the afternoon, especially after sitting for long periods or doing simple daily tasks like gardening or shopping, a stale or sour smell may become noticeable. There's also another hidden factor: laundry. Synthetic fabrics don't wash clean as easily. They tend to hold onto body oils and odors deep in the fibers, meaning even after a wash, that smell can reactivate with body heat. I remember Diane, a 70-year-old woman, who was frustrated because no matter how often she showered or washed her clothes, the odor returned. After we talked, she realized she wore tight, stretchy leggings every single day. Once she switched to looser cotton pants and breathable underwear, the change was incredible. She said, "It was like a fog lifted. I didn't realize my clothes were holding everything in." If you've been doing everything else right but still feel something isn't fresh, take a look at your closet. Looser fitting clothes made from natural fibers like cotton or bamboo allow your body to breathe. And when your skin can breathe, odor doesn't stand a chance. Letting your body breathe isn't just about comfort, it's a powerful way to stay fresh, confident, and completely in control of how you feel every single day. If you're still here and finding these tips helpful, comment #4 below. And if you haven't subscribed yet, hit that subscribe button and turn on the notification bell so you don't miss more helpful videos like this one. Mistake number 5, neglecting proper intimate hygiene. Even the cleanest women can sometimes miss one key area of care: intimate hygiene. As our bodies age, this area needs special attention, but many older women assume that a daily shower or quick rinse is enough. Unfortunately, when it comes to preventing urine odor, general washing doesn't always address the real source. The problem isn't usually a lack of cleanliness. More often, it's using the wrong products, skipping the area entirely out of fear of irritation, or simply not realizing how much residue can build up throughout the day. The folds and delicate skin in the pelvic area require gentle, targeted care. Using harsh soaps or heavily scented cleansers can actually make things worse. They strip the skin of natural oils, disrupt its balance, and cause dryness or irritation, which can amplify odor. On the other hand, not washing properly at all can leave behind bacteria and tiny traces of urine that no amount of perfume or powder can mask. The best approach? Keep it simple. Warm water and a soft cloth, nothing more, are often enough. No scrubbing, no medicated washes, just gentle, consistent care. For women who use incontinence pads or deal with occasional leaks, a quick rinse or an unscented cleansing cloth during the day can make a huge difference. And after any noticeable leak, changing clothes and freshening up, even if it's just a warm cloth, can stop odor before it sets in. I remember June, an 82-year-old woman who bathed daily but still struggled with odor. She used perfume soaps and powders, thinking she needed to mask the problem. But when she switched to simply rinsing with warm water twice a day, once in the morning and once in the evening, everything changed. She told me, "I thought I needed to scrub harder. Turns out, I just needed to be gentler and more consistent." One more tip: always dry the area thoroughly after washing. Dampness left behind can trap odor, just like tight clothing can. A soft towel and a few extra seconds of care can make all the difference. Proper intimate care isn't just about hygiene. It's about comfort, dignity, and feeling confident in your own skin. And the best part? It doesn't require fancy products, just awareness and a little kindness toward your body. Mistake number 6, not changing underwear daily or after leaks. It may sound surprising, but one of the most common reasons urine odor lingers in older women is not changing underwear frequently enough, especially after small leaks. As we get older, routines sometimes become more relaxed. Many women choose comfort or convenience, and underwear might not be changed as often as it once was. But here's the truth, underwear plays a much bigger role in odor than most people realize. Even the tiniest leak, the kind that doesn't fully soak through, can leave behind moisture and bacteria in the fabric. When that dampness sits against your skin for hours, it creates the perfect environment for odor to develop. At first, it may be subtle, but by mid-morning or afternoon, it becomes noticeable. And it's not just the underwear. That scent can transfer to pants, skirts, or even chairs, leaving a faint trail even when everything feels dry. Some older women even reuse underwear for multiple days, not because they're careless, but because they simply don't see anything wrong with it. The problem is, even microscopic residue builds up. Combined with body heat and movement, this residue can release odor throughout the day. Laundry habits also play a role. Using too little detergent, skipping an extra rinse, or not fully drying underwear can all allow smells to linger in the fabric, even after it's been washed. The solution is simple but powerful: change underwear at least once a day and always after a leak. Use enough detergent, rinse well, and make sure everything is fully dry before wearing it. Clean, fresh underwear acts like a reset button for your comfort and confidence. Storing underwear near used pads or damp towels can also transfer odors without you even realizing it. I once spoke with Darlene, a 75-year-old woman who took great pride in her appearance but still struggled with unwanted odors. She bathed every day, kept her clothes neat, and always presented herself well, yet she still felt self-conscious. When we talked about her routine, she admitted she only changed her underwear at night, right before bed. Once she started switching to a fresh pair in the morning, and again after any leaks, she noticed an immediate improvement. I didn't think it mattered, she told me, but I finally felt truly clean again. No one loves doing extra laundry or making more trips to the drawer, but your freshness and confidence are worth it. Changing into clean underwear at least once a day, or more if needed, isn't just about hygiene. It's about how you feel in your skin, how you carry yourself, and how you step into the world with pride, no matter your age. If you're still watching this video and finding these tips helpful, please comment #6 below to let me know you're here. And if you haven't subscribed yet, hit that subscribe button and turn on the notification bell so you don't miss any future videos that can help you live with confidence and comfort. Final thoughts. Now that we've gone through these 6 common mistakes, I want you to pause for a moment and ask yourself, did any of them sound familiar? Maybe you recognized a habit in your own routine. Or maybe you thought of a loved one who's been silently struggling. Whatever the case, remember this: none of this is about blame or embarrassment. It's about awareness. And awareness is what gives you the power to change. Smelling like urine is not a natural or unavoidable part of aging. It's simply a signal that something, whether it's your habits, clothing, hydration, or health, might need attention. And the best part? You don't have to fix everything at once. Start with one small step. Maybe it's changing your pad more often, switching to cotton underwear, drinking an extra glass of water, or finally getting that low-grade UTI checked. I've seen firsthand how even the smallest change can bring back not just freshness, but dignity and confidence. You deserve to walk into any room without worry. To sit next to someone without fear. To feel comfortable and at home in your own skin, every single day. There is no shame in this conversation. Talking about it takes courage. But that courage doesn't just help you, it helps countless others who are quietly wondering the same things. That's the kind of quiet strength that makes aging something to be proud of, not something to hide from. So, I'd love to hear from you. Which tip spoke to you the most today? Was it something simple you'd never considered? Or a gentle reminder of something you've been meaning to change? Share it in the comments below. Your story might inspire someone else. Thank you for joining us today. If this video helped you, please like, subscribe, and share it. Your support helps us continue creating meaningful content to inform and inspire you. We'll see you in the next video. Until then, remember, you are never too old to feel fresh, confident, and truly yourself again.